The topic for this discussion is treatment of newly diagnosed myeloma. We commonly call the first phase of treatment induction therapy. It's called induction therapy because the goal is to reverse the organ damage and symptoms associated with myeloma, and also to markedly reduce the number of myeloma cells in the patient. Induction therapy usually takes months, and it's important to know that it varies based on the category of patient. So, for example, younger patients under the age of, let's say, 75 may be eligible for stem cell transplant, which we'll talk about in another video. And younger patients eligible for stem cell transplant are going to usually receive a 3-drug combination therapy for initial or induction therapy. These drugs are designed to eliminate as many myeloma cells as possible and to prepare the patient to have stem cells mobilized. That's the term we use for getting stem cells to come out in the blood and collected from the blood, which is a prelude to stem cell transplant. The choice of initial therapies for patients who are not stem cell transplant eligible, and usually those are older patients, can include 2-drug as well as 3-drug treatment regimens. For most older patients, a 2-drug regimen is quite effective. The duration of treatment with chemotherapy for patients who are not transplant eligible may extend to as long as a year. The advantage of new medicines, ones we expect to be approved in 2016, will be that the 3-drug regimens and the 2-drug regimens can all be given in pill form. One of the new medicines, a monoclonal antibody, requires intravenous administration, but it's unlikely that the monoclonal antibodies will be approved for initial or induction therapy. The questions you should ask your blood doctor, your hematologist, are: how likely is it that initial therapy will reverse the damage that's been done to my bones or my kidneys? How long will it take for my kidneys to get better? When can I expect that my bones will begin to heal and I'll have less pain? Other questions of importance are: what stage is my myeloma? And what are the genetic features of my myeloma that might influence my response to treatment? The drugs that are used for initial therapy come from different categories of drugs. Most patients will receive an immunomodulatory drug, which is in pill form, most likely lenalidomide or Revlimid. And many patients, particularly those who are transplant eligible or who have some degree of kidney damage, will receive bortezomib or Velcade, which is given subcutaneously and can be given intravenously. In addition, all patients will likely receive a steroid therapy in the form of dexamethasone. Dexamethasone is a pill which can be taken several days in a row or once a week as a rule. The important measures of response to initial therapy are how you feel, what happens to your pain, what happens to your energy level, and also what happens to the myeloma cells. We measure that response by following the monoclonal protein levels in your blood and or your urine. and we usually do this with each cycle of therapy. How do we score responses to treatment? Well, in myeloma, we score responses to treatment as partial, very good partial, or complete. A partial response is a 50% reduction in the monoclonal protein. That would correlate with at least a 50% reduction in the number of myeloma cells. And many patients who achieve partial responses also feel better and have their organ damage reversed. Very good partial responses are essentially 90% reductions in the monoclonal protein, equivalent to 90 or higher percent reduction in the myeloma cells. And complete responses are disappearance of the monoclonal protein in all its forms, based on all the tests that we do. However, complete responses can have different depths of response. And for that reason, sometimes very sophisticated tests looking for minimal residual disease are used. The overall response rate with modern therapies in induction is about 70 to 80%. Approximately 30 to 35% of those responses are complete responses. Another 15 to 20% are very good partial, and the rest are partial responses. Only a minority of patients have stable disease in the setting of modern therapy for myeloma. And in many of those cases among transplant-eligible patients, they will respond to stem cell transplant, which will be the subject of our next video.